Gauteng mortuaries have been experiencing a sharp increase in the admission of dead bodies of late. Now, the problem of unclaimed or unprocessed bodies has been an issue for a while, but there's been some real progress in recent weeks. And I'm joined now by Thembalethu Mpahlaza, Acting CEO for Forensic Medical Services in Gauteng's Department of Health. Thank you so much for joining us. So it seems you've got the problem mostly under control, but I'm just curious because the statement that came out today talks about this sharp increases in bodies admitted to mortuaries in Gauteng. Why has there been such an increase?
Good evening to you and to your viewers. Apologies for the visuals. We are having load shedding in Johannesburg.
That's all right. We're used to it by now. So just talk to me. I know you're going to tell me about the interventions, but just talk to me about how, why so many more dead bodies than usual?
You know, the issue of the number of cases that we are receiving recently, I think the issue of the violence that is taking place in our communities is contributing, have contributed a lot in this challenge that we are faced with now. As you will notice that most of the cases that we are receiving, especially in the Johannesburg area, in Hillbrow in particular, are cases that are related to the issues of the gunshot, followed by the cases that are related to the motor vehicle accident. And those cases are cases that needs advanced expertise in terms of examining them. And they are not the cases that you can just admit today and deal with them instantly. Yes.
Yeah, so in other words, you know, you need, and you know, you say that you need more staff, but I think it was last week you set up a special task team to deal with this issue, and I understand now that the backlogs have been cleared, and I want to know how you've been able to do that, bearing in mind you have a staff shortage.
Our service make provision for the appointment of sectional doctors because, remember, the issue of the death is not something that you can really invest on or celebrate when it happens. Yeah. So our work depends on the referral of cases from the police to investigate. We can appoint 100 doctors to be in place, but you will find that you don't get value for money if there are not deaths that are coming in or cases that are referred to us. Hence, it is important for us to have doctors that we are appointing as sessional doctors, whom we will call when there's a time for need or for a situation like this.
All right, so you've been able to mobilize almost like freelance doctors to help you clear those backlogs. But just generally speaking, you know, Gauteng it's an urban province and there's rapid urbanization. A lot of people, especially when times are tough, they move to the city because they think it's their best opportunity to find work. Do we actually have enough mortuaries in Gauteng to deal with our rapidly increasing population here?
Yes, I agree with you. The issue of increase in Gauteng is a challenge for us. With 11 institutions that we are having, we are doing the best that we can out of them. But as you might have heard from the news, that there is a bigger institution that we have built in Helen Joseph hospital area, which will then give much relief, which is needed for the Hillbrow facility. We are intending to also take the service to our people. We are in a planning stage now to build another institution in the area of the Hammanskraal to make sure that we reduce the number of bodies in facilities that are servicing that particular area, which is Garankuwa in this regard. We are also, in terms of our long-term plan, to build another institution along the Midrand area, trying to minimize the load that is carried by the Johannesburg mortuary as well as the Germiston. So,
You've got plans.
in terms of our long-term strategies, yes, we are heading for that now.
All right. Thembalethu Mpahlaza, thank you so much. He's the acting CEO for Forensic Medical Services in